Welcome. Today we are going to talk about perimenopause and menopause. So my name is Nicole Smith. I'm a doctorally prepared nurse practitioner, board certified in family practice, orthopedics, and I'm also a certified personal trainer and founder of Anti-Gravity Wellness. So menopause is that point in time when a woman has not had a menstrual period for 12 consecutive months. And that's very important because if we go 12 months, 39 days, and then have a period, the clock restarts. So that's an important distinguishing feature right there. However, the process leading up to menopause and the time afterward are characterized by different changes and experiences that aren't often talked about. So that's what we're going to talk about today. So perimenopause is often called the menopausal transition. This is the period leading up to menopause, and it can start several years before the onset of menopause and typically begins in a woman's 40s, although it can start in the late 30s for some women, maybe even earlier for others, depending on what's going on with them and their genetics. During perimenopause, hormonal fluctuations, particularly in estrogen and progesterone levels, become more pronounced. This can result in various physical and emotional symptoms such as irregular menstrual cycles, hot flashes, night sweats, mood swings, and changes in sexual function. Fertility gradually decreases during perimenopause, and it becomes more challenging to conceive. Postmenopause, as we discussed before, begins when a woman has gone through 12 consecutive months without a menstrual period. It is the phase that follows menopause and lasts for the rest of the woman's life. Hormonal fluctuations generally stabilize, and many symptoms experienced during perimenopause tend to diminish. However, other aging-related health concerns such as osteoporosis and cardiovascular disease may become more significant during this stage. Women may also experience vaginal dryness, urinary incontinence, and changes in sexual desire and function during postmenopause. Women must maintain their overall health and well-being during postmenopause, including staying physically active, eating a balanced diet, and discussing hormone replacement therapy or other treatments with a provider if necessary. Both perimenopause and postmenopause are natural phases of a woman's life. And while they can bring challenges, they also mark the end of a woman's reproductive years. Women experiencing symptoms during these stages should consult with a healthcare provider for guidance and potential management of their symptoms. So, we're going to talk about the signs and symptoms. While not all women are the same, many experience some variation of the following signs and symptoms on the next slides. So, some of the hallmark signs and symptoms include irregular menstrual cycles. This is the hallmark sign of perimenopause, which is your periods may become shorter, longer, lighter, heavier, or even more erratic in terms of timing. Next, we might see hot flashes and night sweats. Again, not everyone experiences these, but some people do. Many women experience sudden, intense sensations of heat known as hot flashes, often accompanied by profuse sweating, particularly at night. Sleep disturbances. Sleep problems are common, including night sweats that disrupts sleep, insomnia, or other sleep disturbances. We can also see mood swings. Hormonal fluctuations can lead to mood swings, irritability, and emotional changes. Some women may experience increased anxiety or depression during perimenopause, and there are some that actually are basically not themselves anymore. And if that's the case, if you've noticed that you or someone you know is kind of in this age range and they're just kind of all over the board and they're not acting like they used to, it could be their hormones. And if we take a look at that and we're able to reverse that, we might be able to get them back to feeling like themselves and acting more like themselves. Vaginal changes, vaginal dryness and discomfort during intercourse, and changes in vaginal lubrication can occur. And again, this is changes in the estrogen that's happening in the body. As we start to decrease our estrogen supply, we start to see these symptoms. Then we can see also changes in sexual desire. Again, same thing. Some women may experience decreased libido or changes in sexual desire and response, We can also see weight gain. Again, changes in hormone levels can contribute to weight gain, especially around the abdominal area. That is such a common complaint that I get, that women say, I used to be able to lose weight, no problem. Now it's just been creeping on and it's all in my belly and I cannot get rid of it. Very common. Breast tenderness and discomfort can be a symptom of perimenopause. Typically, this kind of comes around the premenstrual period, but it can also start fluctuating all over the place. And if you never really used to have a problem with that, and all of a sudden now you do, that's a sign of perimenopause. Changes in skin and hair. Skin may become drier and hair may thin or change in texture. Also, estrogen. Estrogen gives us that vitality, ladies. So when our estrogen starts running lower, we start noticing these changes. And you might actually only really notice these changes in the last part of your menstrual cycle, which is called your luteal phase. So your follicular cycle is the beginning, folliculars first, then ovulation, and then luteal phase. And that's where the progesterone tends to rise and the estrogen tends to go down. Now, that's within normal, but there are various things that can happen within that range that we will also kind of go over. And then we can see some cognitive changes. Some women report difficulties with memory, concentration, and cognitive function during perimenopause, also called brain fog. We can see urinary changes. Perimenopausal women may experience an increased risk of urinary incontinence or other urinary symptoms, especially if we're combining this with if you've ever had children vaginally or had any surgeries down there or anything like that. There can be some issues. This is also like the incontinence and things like that can also just be related to the decrease in estrogen, and the tone down there can be messed up. So there's a combination of things that we can do, including like pelvic floor specialists, physical therapy that can help with these things. We're going to be having some changes in bone health during this time too. Due to declining estrogen levels, there is an increased risk of osteoporosis that starts to develop during this phase. And some women may actually experience irregular heartbeat as well, such as palpitations or irregular heartbeats. It's important to note that not all women will experience every symptom, and the severity of symptoms can vary widely. The duration of perimenopause also varies from woman to woman, but it typically lasts for several years before menopause is reached. If you are experiencing disruptive symptoms during perimenopause, it's a good idea to consult a healthcare provider. They can guide symptom management and discuss potential treatments or lifestyle changes to help you navigate this transitional phase more comfortably. To determine if a woman is entering perimenopause or menopause, healthcare providers may use a combination of medical history, physical exam, and specific lab tests. While there is no single definitive test for perimenopause or menopause, the following are some of the common laboratory tests and markers that we may check. So we have follicular stimulating hormone, FSH, and luteinizing hormone, or LH. So these hormones are produced by the pituitary gland in the brain, and that play a key role in regulating the menstrual cycle. In perimenopause and menopause, FSH and LH levels tend to increase. So elevated levels of these hormones can be indicative of the hormonal changes associated with these stages. Why is it increasing? It's telling the ovaries, hey, we're noticing you're not putting out as much like estrogen and progesterone. So why don't you kick that up? But the ovaries are like, you know what? We're actually going into retirement. We're going to be done with this real soon. So we're actually going to start slowing down production. And this is just what it's going to be. So that's what's going on there. Next, we also look at estradiol or E2 levels. So estradiol is a form of estrogen. There's several forms of estrogen in the body. In perimenopause and menopause, estrogen levels decrease. Measuring the estradiol levels can help assess the changes in estrogen production. This can also give us a clue as to why a woman's feeling the way she is. Testosterone, super important for women, just as it is for men. We just have lower levels of it, ladies. Testosterone is an important hormone for perimenopausal and postmenopausal women, although it is often less recognized compared to estrogen and progesterone. Testosterone naturally declines with age, but there are things that we can do to support healthy levels. Then we have DHEAS, which stands for Dehydro epiandrosterone. It's a tongue twister. It is an adrenal hormone that can be converted into sex hormones, including estrogen and testosterone. DHEA also naturally declines with age. This comes from the adrenal glands, and it becomes, especially as we are getting closer to and past menopause, our primary source of these sex hormones because the ovaries are done. And then we have our thyroid function test. So it's very important that we're always monitoring our thyroid health. This can affect the menstrual cycle and other symptoms commonly associated with perimenopause. Thyroid stimulating hormone and thyroid hormone levels, T3 and T4, may be checked to rule out thyroid disorders. And we can also look at thyroid antibodies because Hashimoto's thyroiditis is the most common form of hypothyroidism. And then we're also going to look at prolactin levels. Prolactin is a hormone produced by the pituitary gland that plays a role in regulating the menstrual cycle. Elevated prolactin levels can lead to irregular periods and may be checked to rule out certain conditions. Elevated prolactin can also contribute to low libido, by the way. Complete blood count, CBC, and other blood tests. So a CBC can help assess overall health and detect anemia, which may be more common in perimenopause and menopause due to changes in menstrual bleeding patterns. So especially if we're having heavy bleeding, we could see some anemia. There's also issues with digestion and absorption and quality of diet. All of these things play together to create this pattern here. Other blood tests may be conducted to assess cholesterol levels, blood glucose, kidney function, liver function, all of these things. The body is a whole organism, guys. So if one part isn't working right, it's going to cascade to the other ones, and we're going to have issues. And sex hormones tend to be at the bottom of the barrel as far as it is concerning priority in the body. We don't need sex hormones to survive as much. We need our thyroid, we need our adrenal glands, we need our brain function, we need our glucose. And if those systems are starting to go awry, then down the line, we are going to have problems with the sex hormones being nice and balanced and having, minimal symptoms with that. Because the body goes, you know what, if it's not safe for the organism, because we're under this chronic stress, we have this inflammation in the gut, we've got a chronic mold exposure or other type of toxin, we have all of this mental stress and anxiety that we're constantly going through, it's not safe to reproduce. So we're going to downregulate all of these systems in order to survive. So your body is trying to protect you. So when we understand that, then we go, oh, okay, so I need to take care of my body so it can take care of me. It's important to note that these lab tests can provide valuable information, but they are often used in conjunction with a woman's reported symptoms and medical history to make a comprehensive assessment of perimenopause or menopause. The specific tests ordered may vary depending on the individual's clinical presentation and the healthcare provider's judgment. In many cases, a healthcare provider may also consider factors like the frequency and nature of menstrual cycles, age, and the presence of other associated symptoms when making a diagnosis of perimenopause or menopause. The treatment options for perimenopause focus on managing and alleviating the symptoms associated with hormonal changes and supporting the women going through this transitional phase. Treatment choices can vary based on the severity of symptoms, individual health factors, and personal preference. So here are some standard treatment options for perimenopause. Number one, first and foremost, always, 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 lifestyle modifications. This is the basis. This is the bottom of the pyramid. Always. Healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help to manage weight and provide the essential nutrients that the body needs in order to function properly, especially those healthy fats. Really, really, really important. I really push omega-3s, most importantly in the diet, because we just don't get enough of them. Regular exercise, not too much though. Okay, so we're not trying to do a bunch of HIIT cardio, a bunch of CrossFit classes or Orange Theory multiple times a week. No, no. Your body needs more time to recover the older that we get. So targeted exercise and more walking than pretty much anything else, but it's also super, 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 super important to do weight training Strength training, what builds muscle builds bone, and we need that. We absolutely, it's so vital to decreasing your risk for all kinds of chronic diseases and joint pain and general pain and insomnia and all the things. So, so important, ladies. Can't stress it enough. So, engaging in regular physical activity can help with mood swings, weight management, and overall well being. It works as well as Prozac, guys. It also helps to improve insomnia, a common problem during perimenopause and menopause. Getting in a 10-minute walk outside in the sunshine in the morning is the bare minimum, at minimum. And sunshine is super important for your circadian rhythm. Stress reduction. So, stress management techniques such as meditation, yoga, or deep breathing exercises can help alleviate mood swings and anxieties. These practices also reduce the burden on the adrenals, which is super important for those who suffer from chronic stress. Hello. Which is also common among women in this age group. Ladies, we are burning ourselves out. We got to stop. Remember how important those adrenal glands are, especially as we get older. Adequate sleep. Oh, no excuse for this, right? Good sleep hygiene practices can help reduce insomnia and improve overall sleep quality. A good night's sleep starts in the morning. With sunlight in the eyes indirectly. Never look at the direct sun, all right? And on the skin for at least 10 minutes. That's why I combine that with a little walk, and there you go. This helps set the internal circadian clock in the body. In the evening, having an evening wind down routine, avoiding blue light from screens and TVs. This is the wavelength of light that tells the brain that it's daytime and actually suppresses your melatonin, which is necessary to initiate and maintain good quality sleep. And keeping consistent bedtime and awakening times every night, even on the weekends, it's really essential for good sleep. We really have to prioritize this, ladies. I know it's really hard, but trust me, I know from experience, once I stop fighting this and just let me adjust my routine because my body likes this particular sleep schedule. Holy crap, like my daytime fatigue cut drastically. All right. So some natural sleep aids may be helpful if you are having trouble sleeping, like melatonin. We try to avoid medication for sleep as there are many of these that are addictive and do not actually induce deep wave sleep, which is vital for the restoration and repair of the brain and the body. But you know what? We use medications when we need to while we're working on underlying causes. That's our philosophy here. Okay. Digestion. Changes in digestion alter the body's ability to absorb necessary nutrients for healthy hormone balance and affect the body's ability to eliminate excess estrogen. Did you know that? It actually is eliminated through the gut, especially through liver. So if you have any symptoms of bloating, gas, indigestion, constipation, or diarrhea, or have been diagnosed with a GI disorder such as IBS, the underlying causes must be addressed. An elimination diet is usually one of the first steps, along with slowing down to thoroughly chew each bite of food, keeping a consistent eating schedule, just as you do a consistent sleep schedule, not skipping meals, avoiding processed foods and added sugars, and decreasing alcohol and caffeine consumption, especially alcohol, guys. Caffeine also, we got to watch that. But the alcohol, as we get older, we don't metabolize it the same way. And you will feel the effects way more. And it affects your sex hormones. Okay. It'll make your symptoms worse. It'll make your PMS worse. It'll make your cycle regularity worse. So stop with the nightly alcohol. Stop with the nightly glass of wine. It's not doing you any good. It's really not. I know you think it might help you unwind. Drink some herbal tea. Find a different way to unwind in the evening. Hormone disruptors. So hormone disruptors are any substance that can alter the body's internal hormonal balance. These chemicals, pesticides, fragrances, cosmetic products, cleaning products, and smoke exposure are found in the environment. While it is not possible to eliminate all sources of hormone disruptors, cutting back on exposure is an essential step to improving your body's ability to detox, methylate, and eliminate toxins that can disrupt the delicate hormonal balance, leading to symptoms such as worsening PMS, abnormal bleedings, fibroids, thyroid disorder, and so many more. Yucca app. YUKA is my favorite. And I use that to, you can scan, go to the store, or you can even like enter in the names of products, skincare products, hair products. I don't know if they do so much cleaning products and things like that, but you can look at those and it will actually give you like the breakdown of like, is it okay? Is it not so okay? Is it really bad? And then why? It actually has the links to like the ingredients and then the studies and then how it's all illegal to use over in Europe, but here we are. So I've really been able to clean out a lot of things and feel a lot better about what especially what I'm putting on my skin. Your skin is your biggest organ in your body and it's highly absorbable. So it like sucks everything in. And if you're constantly putting toxins on your skin every single day, that's just putting a burden on your body that it just does not need. All right, so what can we do? Hormone replacement therapy is an option, and it's a really, really great option, guys. So, HRT, hormone replacement therapy, involves taking hormones like estrogen, progesterone, and even testosterone and DHEA to replace the declining levels in the body. Yes, we can put women on testosterone. It can be super helpful, especially like topical testosterone to the vaginal area for things like dryness and decreased libido and things like that. It can be super, super helpful. It can effectively relieve symptoms like hot flashes, night sweats, and vaginal dryness, and this is all the HRT. However, discussing the risks and benefits with a healthcare provider is essential, as HRT may not be suitable for everyone and carries potential health risks. You will need a baseline mammogram, you'll need your labs, you need a sex hormone panel, lipid panel, and a physical exam and blood pressure before starting hormone replacement therapy. You will then need to repeat labs about every 3 months and exam with blood pressure until optimal levels and symptom control are obtained and to monitor for side effects. You will need an annual mammogram while on HRT. Super important. We want to make sure that we're not missing anything or making anything worse. So, very judicious use of this, but it can really make a huge difference in how a woman feels and is able to function in her life. And that's all we're trying to do is just improve the quality of your life while, of course, minimizing risks of any side effects that can happen. Very safe, though. There are also non hormonal medications that are sometimes used. And again, remember, we use medications when we need to while we are still addressing the underlying cause. Okay. Because if we can't get you to that baseline of I just can even get out of bed, how can I expect you to eat healthier or go for a walk? Okay. So sometimes we need a little help, and that's okay. There's nothing wrong with that. A lot of these we don't necessarily like, especially these ones, we don't want to use them forever. We don't want to just throw you on a medication and then there you go. You're just going to be on it for life. No, like let's see what else we can do to try and see if we can correct the underlying causes or get you through this phase of your life to a point where now everything's evened out and we don't need these things anymore. So we have things like SSRIs, selective serotonin reuptake inhibitors, or SNRIs, kind of similar serotonin norepinephrine reuptake inhibitors. And these are typically used for depression, but these will also be used to treat mood swings in perimenopause and menopause and hot flashes. Work in the brain that way too. And then low dose antidepressants or gabapentin may also be considered for symptom management to help with these symptoms as well. Vaginal estrogen. So for vaginal symptoms, for women experiencing vaginal dryness, which is also known as vaginal atrophy or atrophic vaginitis, discomfort during intercourse, which is known as dyspareunia, or urinary symptoms such as burning, frequency, urgency, frequent UTIs, low dose vaginal estrogen therapies such as creams, rings, or tablets may be prescribed. You must be still monitored on these medications just as you would for an oral HRT treatment. More natural remedies include oils you can cook with or use on your skin, such as coconut or almond. So if you can eat it, you can put it down there. Be sure to use oils without allergens, which vary from person to person. So if you're allergic to almonds, don't use almond oil. If you're allergic to coconut, don't use coconut oil. Okay, common sense. Stop using if you experience burning or itching. Never put things on broken skin. Okay, if there's any type of rash or any redness or irritation, make sure you get this checked out because there could also be an underlying infection. We need to treat that before progressing to other things, right? Um, and know that oils, such as these used for lubrication, will cancel out the effectiveness of condoms. So if you're using condoms for STI or birth control prevention, then you would need to use a different type of lubricant that is water-based. Oil-based lubricants will break down the integrity of condoms and they won't work. All right, herbal remedies and supplements. So some women use herbal remedies like black cohosh, red clover, and soy isoflavones to manage symptoms. The efficacy of these supplements can vary, and it is essential to consult with a healthcare provider before using them. Herbals are definitely something that I use in my practice quite frequently with women. A lot of people are more apt to go for herbals as opposed to medication. And it doesn't necessarily mean that herbals are any safer, and we have to be very careful of the source. So I'm very careful about where I source all of my supplements for my clients and even for myself. But I have personally used some herbals for myself as I am in perimenopause and was noticing some changes as well. And it has really helped my symptoms. So, but everyone's a little bit different. It's just like a medication. You might take a medication and it just doesn't work for you, but it works for somebody else. Same kind of thing. And then we also have complementary and alternative therapies. So we got techniques such as acupuncture. Acupuncture is very, very effective, guys. It's super, super helpful for a lot of different issues, but this is one of them. Acupressure, which is kind of similar, except not the needles, just pressure instead. And then mind body practices like yoga and meditation can definitely help alleviate some perimenopause symptoms. And of course, helps with our adrenals, which are taxed, very taxed adrenals. Lifestyle changes for bone health. So, women may be advised to increase their calcium and vitamin D intake to support bone health. So, it's very important that we're monitoring these things. I have pretty much everyone on 4 to 5,000 international units of vitamin D3 per day. And I do combine that with actually checking their vitamin D levels. Some people don't need that much, some people need more. And then with calcium, we make sure that we're getting 1,200 milligrams daily intake for women, for adult women. And we want to get most of that through diet. So at most, I might give them like 600 milligrams of calcium supplementation, but the majority of it we're trying to get uh, from diet. So that's like half of it right there. That would be somebody who really like, if they're not, they can't tolerate dairy and they don't get a really good source of calcium in their diet, that would be somebody that I would probably do a higher dose of a calcium supplement. But definitely better to go through the diet. It absorbs better in the body that way. And we need vitamin D in order to absorb calcium and tell it where to go, which is in the bones, which is where we want it, right? It's our deposit. It's like the bank. The bones are the bank for the calcium, okay? And magnesium and other things too, but especially calcium. So weight bearing exercises are also crucial for maintaining bone. Like I mentioned earlier, what builds muscle builds bone. So anytime you're doing weight bearing activity, walking is a start. It's not enough though. We have to do upper body exercises. Ladies, especially upper body exercise. I've seen so many women so working with orthopedics, most of our total shoulder replacements is older women who tear the rotator cuff, reaching above their head to get a can. That's it. Like it's nothing strenuous, but they have no upper body strength and they have not been training that. So they're more prone to have these issues. So it's so very, 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 very important all the way head to toe, basically doing strength training just twice a week, total body, 45 minutes per session. That's it. That's all you have to do in order to build and then maintain adequate muscle and bone strength. Pelvic floor exercises. So pelvic floor exercises or Kegel exercises can help with urinary incontinence and pelvic floor muscle weakness. You may be referred to a physical therapist specializing in pelvic floor issues if you have severe symptoms such as pain and urinary incontinence. You can also search for this type of therapist in your area. I do have one here in the Tri Cities that I really love. She's fantastic. She's a doctorate of physical therapy and specializes in women and pelvic floor disorders. So that's where I send my people locally here. And then people elsewhere, I'll either help them find someone or they already have found someone to help with that. It's essential for women experiencing perimenopausal symptoms to work with a healthcare provider to develop a personalized treatment plan tailored to their specific needs and health considerations. The treatment choice should consider individual medical history, the severity of symptoms, and the potential risks and benefits associated with each option. Regular checkups with a healthcare provider are essential to monitor progress and adjust the treatment plan. So, where can you get your hormones tested and see if you could benefit from treatment for perimenopause or postmenopause? Suppose your PCP or GYN is uncomfortable or unfamiliar with managing perimenopause or menopause, or you want a more integrative functional approach. In that case, at Anti Gravity Wellness, we are accepting new patients into the Perimenopause and Menopause Optimization Program. This is located in Washington State. We do telehealth visits. Um, we do prefer to see people in person, at least for the first visit or even one of the subsequent visits. But if you want to do all telehealth and you're not in the Tri City area, that's fine too. All right, so here is the contact information. Use discount code anti-gravity 10 for 10% off your next service. If you scan the code here, it'll take you to our flow page that has all of our information. There's our location, our clinic phone number, location, and then support at anti-gravity coach or at actually at antigravitywellness.com as well. Thank you so much all for your attention. And if you do have any questions, you can put them in the comments or contact us if you would like to set up an appointment. Thank you.